Hi, I'm Kim Fanguy. I'm a nurse practitioner. I am here today to ask you a few questions. Number one, are you having any problems with forgetfulness, memory loss, brain fog, anxiety, depression, sleep problems, difficulty falling asleep, difficulty staying asleep, irritability? Do you kind of feel like maybe you're not at your optimal, that you just feel like something's wrong, but you don't know what it is? Well, guess what? These are all signs of brain inflammation. Yep. And they can wreak havoc on your personal life, your work life, and any other part of your life, honestly. But over time, it only worsens. It doesn't get better unless you actively work on it. Now, a lot of times, the traditional medical providers will order some lab work, and 9 times out of 10, it comes back normal. Occasionally, you might see some hormonal stuff, but typically it comes back normal. And then what do you do then? Because they don't know where else to go. However, there are some things that we can work on. I am a functional medicine practitioner, so what does that mean? That means that we are looking beyond just labs. I mean, we're going to do labs, but we look at more. We look at everything from your childhood, your prenatal, your mother's health, your health as a child, your health as a baby, and on up to present. But I really want to drive this point home that it really has to start with working on it today, not waiting until something else comes along, something else shows up, because this brain inflammation only worsens. And unfortunately, left unattended, for many people, it can lead to dementia. It can lead to permanent memory loss. So we can turn all of that around by uncovering those things that are particular to you. And that's what we call personalized medicine. It is what functional medicine does, is that we take you and your particular problems and help you come up with a treatment plan. And we do that together, and that's called partnering. But again, being assertive and getting on the bandwagon of starting to fix these problems and turning this brain inflammation around so that now you can become a better you, but not just a better you, but that you can feel better, because that's ultimately what it's about. And of course, what does this all lead to? It leads to longevity, and of course, a healthy longevity. So I hope that you'll consider all of these things. Again, these problems, if you're having any of those are, we call them symptoms, but actually they're signals from your brain telling you, hey, something's wrong and we need to get it fixed. If it goes unattended, your brain only has so much capacity to kind of to stave off the problems, but you have the ability to move forward and reverse it, because believe it or not, despite what you may hear, brain inflammation can be reversed. It takes work, it takes effort, it takes patience, and it takes somebody that's partnering to figure out how we're going to do that. But it really, all of those answers come from you, and I believe that I can help you and partner with you and start the process of turning this stuff around. I've worked a long time, for over 10 years, with brain injury patients, a lot of soldiers who have mild TBI, It all goes hand in hand. Concussions, if you've ever had a concussion, that puts you at higher risk. So again, we have to get this stopped before it gets worse, and that we need to try to move into optimal health for you, for brain health for sure. And we can do that today. I hope that you will give me a call. There's a button on the screen right there. You can schedule a call with me. We can talk. It's about a 45-minute call. So anyway, thanks so much. I hope you have a wonderful day, and I hope to see you. Take care.